Hello everybody, I'm John Turner. I'm the Chief Executive of the NHS Lincolnshire Integrated Care Board, and I'm absolutely delighted that today we're able to launch the Lincolnshire Research and Innovation Hub. This marks another really significant step forward in how we all work together in Lincolnshire, how we develop health and care in Lincolnshire, and the continuous evolution of the Lincolnshire integrated care system. We all know in Lincolnshire that we serve a large county, a predominantly rural and coastal county. We know that across Lincolnshire, our population suffers a range of inequalities and a number of access to service issues. At the same time, we know that our setting in Lincolnshire is our unique selling point, and as we look to the future and build forward, we really want to be the very best we can be in the way in which we serve the people of Lincolnshire across our large and beautiful county. We know that understanding the needs of our population is really important. We know that continuing to build the skills and experience and profile of our clinical care across the county is just so fundamentally important. If we want to be the very best version of ourselves that we can be going forward, if we want to continue to be really ambitious in what we can do in the way in which we serve the needs of the people of Lincolnshire, we know that we need to continue to grow research and innovation and understanding of the needs of our population and how our services can evolve and develop to better meet those needs. We also know that we want to grow great clinical skills and further grow our clinical workforce in Lincolnshire. We want people working in the county to really feel that they've got interesting roles, and Lincolnshire's a great place to work as a clinician, where you're supported to evolve and develop your skills as well, and what you can give to the people of Lincolnshire. So having research and innovation as something that clinicians across the county are able to engage in, be part of and develop their interest in is fundamentally important too. The relationship that the NHS in Lincolnshire has with the University of Lincoln has really grown in the past couple of years. There's a vast range of work and programmes that we do together. We've got a really strong partnership, so I'm really delighted that this is a further development in the brilliant relationship that we have with the University of Lincoln, and the way that we're going to continue to build that relationship around a whole range of things, but clearly research and innovation as well is right in the heart of what I think is a really exciting development we've got here. So this is a mega step forward for us. Really excited with this. I think there's a lot we've got to do together going forward, and having the Research Innovation Hub within our overall strategic relationship with the university and within our overall ambition around clinical excellence in Lincolnshire is really exciting. So I hope we have a great launch today. I think we can build our expectations of how we're going to continue to work forward on this, and exciting times. Let's crack on.
So hello everyone, my name is Karen Dunderdale and I'm the Group Deputy Chief Executive and the Chief Nurse across Lincolnshire Community Hospital Services and United Lincolnshire Hospital Services. And research and innovation is important to my organisation because it helps us increase our knowledge about people's health and well-being, And this in turn means that we can provide life-changing treatments, diagnose diseases earlier or more accurately. And I believe that if we create a people-centred research and innovation environment, it should empower colleagues to lead, participate in and deliver research where research is fully embedded in practice and professional decision making, ultimately for public benefit. So ultimately, research and innovation is necessary in any professional field to advance and improve practice, improve patient outcomes and reduce unwarranted variation in care and treatment. And our objectives are about patients, people, services, partners and population. We're committed to ensuring that patients receive high quality care and recognise that it's equally important for us to conduct and apply research and innovation to build better ways of working into our services for the future. Research and innovation helps us to better understand why people develop a disease and others don't. Clinical studies also enable us to test the effectiveness and safety of new medicines and devices. And I hope this will lead to earlier detection and treatment of disease, better treatments to prolong life, and better quality of life for all. Of course, all of this can only be achieved by partnering with our clinicians, academic and industry partners, so that we can learn how to improve NHS healthcare for future generations. I think we're committed to enabling research and innovation be everyone's business, and to ensure that research and the ability to innovate is accessible to all our patients and the workforce equally. And I think that health and care, the landscape of this has been evolving. We're moving ever increasingly to integration and joint working between different organisations, and indeed my own role spans both the hospital organisations and the community organisations. And this is so that we can better deliver value for patients and the taxpayer. The pandemic, I think, has been an absolute catalyst for the development and implementation of innovative ways of working and the delivery of clinical care. I also think that public awareness of the benefits of research has increased as the results of COVID-19 have been felt. So has the acceptability, the willingness and the capabilities to evolve clinical services and departments in innovative ways of working to achieve the best for patients and our people. Those parts of the country that have put research and innovation at the forefront of what they do have been shown to deliver better care. They have better CQC ratings and better patient outcomes. And the benefits are not just for those who participate in research and innovation, but translate into, I think, all areas of Lincolnshire. So the Lincolnshire Research and Innovation Hub is important to us because we know that the more people who take part, the faster progress we can make to improve health and care across Lincolnshire.
Hi, my name is Chris Wheatway. I'm the Chief Executive Officer for St Barnabas Hospice, and I'm also the Chair of LVET, which is the Lincolnshire Voluntary Engagement Team. Research and innovation is a fundamental building block of what we do. Without research, you wouldn't have innovation. Without innovation, you wouldn't have new ways of working and doing things very, very differently. St Barnabas, in particular, is a provider of specialist palliative care, and that whole agenda is moving rapidly over time, and it needs research. It needs all sorts of research as well, different kinds of models to actually understand culture and practice as well as clinical outcomes. So I'm a big believer in research into all aspects, into leadership, into clinical practice, into how we do things. So it's vital to us and our future. And in relation to the LVET work, it's vital for my wider sector to research, to become more sustainable, resilient, and to again do some of the very, very innovative things that the wider third sector can do and deliver. So research is essential. Research and innovation is very much linked to the delivery of my organisation's objectives. So we want to be the provider of choice for specialist palliative care. So clearly research is very much part of that, driving the quality and the outcomes of that agenda. But particularly one of the things I'm very interested in is how do we reach the groups that are currently not accessing hospice care and particularly specialist palliative care? How do we make that happen? What is the culture of a health and care system that means that there are some people who simply don't get to us? Why is it people get referred to us late, etc.? So I see research absolutely in a fundamental way in delivering our agenda, but also things like fundraising, innovation, doing things very differently. Research informs everything. It's not just as I have said before, not just a clinical thing. Research should inform everything we do, and if we're going to test out things and do things very differently, we need research and we need that evidence base to take it forward. And again, with regards to LVET, our agenda is very much about the resilience and sustainability of our sector, and I can see research being absolutely fundamental in that, in actually asking the right questions and understanding how do we do that and how do we operate within a wider health and care sector. I think the benefits of having a hub, an ICS hub for research and innovation, are many. I think if nothing else, I would say that it is part of Lincolnshire becoming a centre of excellence, and I think that's what we need to do. In all the things we do, we should strive to deliver excellence, and I think this is a key area of one. I think if we've got huge challenges in Lincolnshire, but we also have huge opportunities. You know, where else can you do research linked to coastal, rurality, urban, all those sorts of issues? So I think having a hub, having it led by a system makes absolute sense. I think all stakeholders can have a part in that. But also, I'm very mindful that research is something that draws people in. So there are people who actually get very excited about research, as we all do, but actually undertaking research and delivering it is a key part of a number of different people's posts. And so I think it's, you know, we've got a medical school in Lincolnshire, so having a research hub can only be beneficial for us. But the future of health and care is tied up with innovation and doing things very, very differently. But you need the foundations of research and evidence to do that. So I think it has huge potential to put Lincolnshire on the map again.
Hi, I'm Sarah Connery. I'm Chief Executive at Lincolnshire Partnership NHS Foundation Trust. Research and innovation is really important to my organisation, my trust. Fundamentally, all medical breakthroughs have started with research. We wouldn't have the NHS services that we have today without investment in research over the years, and we need to keep building on that. We face rising demand with ever limited resources, increasing expectations from the population, and we've got to find more effective ways to deliver better outcomes for the people that we serve. Research and innovation definitely link with my trust's objectives. Innovation is one of the values of my trust, so we actively encourage all of our people to get involved in research, delivering research, or being a participant. I myself am a dementia research advocate, and I take part in studies myself, which is really important to me. A key objective in our trust strategy is around constantly striving for new learning in our services through research and innovation. We provide services in a unique county. We have urban, rural, coastal communities, and each of those brings certain challenges in terms of the service delivery, in terms of staff recruitment. So investing in research and innovation allows us to build the evidence base around how services can be more effectively provided in rural and coastal areas. It also provides key development opportunities for our people to help recruit and retain staff into research active roles. I feel that there are lots of benefits that an ICS research and innovation hub can bring to Lincolnshire, both to the populations we serve and also to our workforce as well. So the hub will, in my view, really help to bring together our collective efforts, bringing together that diverse thinking across different sectors and different pathways, staff having somewhere to connect across the health and care system for the benefit of their development as well as the benefit of patient care, I think is a really clear positive for me. And that ambition to improve the health of the population of Lincolnshire, you know, we feel that across our different organisations, and we're all trying to make Lincolnshire a great place to live and work and thrive. And I very much see the hub as a key ingredient to that.
Hello everyone, I'm Andrew Morgan. I'm the Group Chief Executive across Lincolnshire Community Health Services NHS Trust and United Lincolnshire Hospitals NHS Trust. And really pleased to be speaking to you about the Research and Innovation Hub, because across both of my trusts, research and innovation is already central to the work we do, but I think the hub will add an extra layer to that work. So as I say, already involved in research and innovation. We have research facilities and staff across the hospitals. We work closely already with a number of research institutions and organisations. So work, for example, with the National Institute for Health and Care Research. I'm actually the Vice Chair of the Partnership Board for the East Midlands Clinical Research Network. We work closely with Health Innovation East Midlands, the old Academic Health Science Networks, I think they used to be called. Obviously work with the National Centre for Rural Health and Care, and of course be remiss of me not to mention my colleagues at the University of Lincoln, who we already work really closely with. Bearing in mind we have a medical school, we're a provider of education, and we have lots of work that we do with our university colleagues. And if you look at what the whole point of the two NHS trusts are about, you know, put simply, it's about better health, better care, and better value for money. And wrapped up in that, if you look at the whole sort of set of objectives that we have as the organisations, they're about patients, they're about our people, they're about our services, they're about our communities, and they're about the health of the population that we serve. And if you then overlay, well, what's research and innovation got to do with it then? You can very quickly see that what we want to do is give people better outcomes when they interact with us, and hopefully avoid them interacting with us in the first place. We want to improve the actual services that we provide. We want to make this a great place in which to receive care and be a great place in which to work. So issues about how we recruit and retain our staff, how we improve staff satisfaction, how we improve the reputation of the organisation, and how we make sure that we provide evidence-based care and evidence-based practice. You can see when you've got those aims in mind that research and innovation plays a key part already in the organisation, but is also something that will attract good people to come and work in Lincolnshire, will attract good people to come and work in our group. That must be a good thing for our patients and our local population. Really put Lincolnshire on the map, not just through the medical school, but all of the bits of work that we do between us. You know, really want to make the care we provide, the people we employ, absolutely central to what we do. And I do think the hub will allow us to bring people together to help with that. You know, we are all part of an integrated care system, but some of the parts does have to be greater than the individual elements. I think having a hub where we can join people up, share our resource, share our expertise, share the knowledge that we've got, but also on occasion, I think, demystify research and innovations. Sometimes you can meet staff who think it's for other people to get involved in that, or other people to get involved in making things better, making things you know, a more improved service. And I'm always very clear, no, it's not. It's for all of us to do that. Everyone can have a role in research and innovation. And I would hope that the hub is not only a statement of intent and ambition for our health and care system, but is also something that people can say, actually, I've got a part to play in that. It can be relevant to my job, whatever I do, whether it's in my group or in other parts of the system, and just increase that understanding, increase that participation, and therefore increase the benefits that we give to the communities that we serve. So both of my trusts, the group, absolutely supportive of the Research and Innovation Hub. We will play our active part in it. We will continue to be a great system partner, and I commend the hub to you.
Hello, I'm Debbie Barnes. I'm the Chief Exec at Lincolnshire County Council, and I'm absolutely thrilled and delighted to be part of this video introducing the Research and Innovation Hub. Research is really important across the whole of the public sector. Research enables our workforce to enhance their knowledge. It informs decision making so that we're able to make the best decisions for our residents, our businesses and our visitors. It enables us to build credibility and confidence with those that use our services. And most importantly, it enables us to introduce new ideas in a safe and controlled way. So the fact that we've got a hub been set up across the integrated care system in Lincolnshire, I think is a great step forward. The hub will give us many, many benefits. It will enable our workforce to share best practice. People will have a single point of contact where they're able to go on and share their research, be able to access the knowledge and learning that's happening across the rich tapestry of research and innovation that's happening across our system. Research and innovation is really important to Lincolnshire County Councils. Councils, as you'll know, span many different services across the breadth of stuff that we offer our residents. So from children's social care, adults learning disability, mental health services, public health services, where we undertake considerable amounts of clinical research, as well as our fire and rescue services and some of our place-based services in terms of highways and heritage services. Producing evidence-based practice is really important across the breadth of those services. And what research enables us to do is it enables us to analyse data, to understand learning from elsewhere. It enables us to present information in a simple way that people are able to understand. And it enables us to make the best decisions possible, which is evidence-based. So we think it's incredibly important and are absolutely delighted to be part of this initiative. So thank you very much.